It's very good morning to all of you, and good evening for Dr. Alice Domar and Dr. Elizabeth Andrio. Please welcome to the ASPIRE Webinar Conference in collaboration with Ferring Pharmaceutical Company with the title Coping Strategies to Support Your Fertility Patients During COVID-19. So as our introductions, we know that our infertile patients is the group who has very sensitive to suffering from stress. So as our many published data explain that at least 30 to 50% our infertile patients suffering from stress, anxiety, or even depressions. Not only women but also men. And not only before ART cycles, but also after ART cycles. And right now, we are in the pandemic of COVID-19. So will our infertile patient increasing the stress or not? And then how do we address, how do we coping our infertile patients to reducing the stress? How our strategy? So together with us, we are very lucky that we're having Dr. Alice Domar and also Dr. Elizabeth Andrio. Both of them are expert in the psychology or stress management. Dr. Alice Domar she's the executive director of Domar Center for Mind and the director of Mind and Body Service at Boston IVF. She is associate professor of obstetric and gynecology and reproductive biology at Harvard Medical School, and she has earned an international reputation as one of the country's top women's health experts. Dr. Domar, welcome.
Thank you very much.
And then we have, and also we have Dr. Elizabeth Andrio. She is the director of psychological services at the Ronald Perelman and Claudia Cohen Center for Reproductive Medicine, and also associate professor of psychology in the Department of Obstetric and Gynecology. And Dr. Grill is experienced as a counseling psychologist and medical researcher with special focus on the emotional aspect of infertility, IVF treatment, cancer-related infertility, and sexual dysfunction. So, together with us this morning, we have both of them to present how both of them their experience in managing, in reducing the infertility and stress for our infertile patient. So without further ado, please welcome Dr. Alice Domar and Dr. Elizabeth.
Just want to very briefly talk about the emotional health of our patients before the pandemic, before we start talking about what the pandemic might be doing to our patients. So if you look at some of the research done over the last 5 or 6 years, we know that our patients are acutely distressed, and the research has shown that 40% of patients, before they even see a physician or go to a clinic, have a diagnosis of anxiety, depression, or both. That was one study. In another more recent study, they found that over half of women and a third of men scored in the clinical range for depression. 76% of women and 61% of men scored within the clinical range for anxiety. And another study showed that about a third of IVF patients had a psychiatric diagnosis. Now, this does not mean that patients had mental health issues before infertility. For the vast majority of our patients, they were emotionally healthy, and they just having a huge impact of infertility. So
basically, based on what we know about what our patients are going through normally, what Ali just said, what Dr. Domar was just saying about all the research, we know that they're experiencing even more anxiety right now as they navigate the system of COVID-19. So obviously having a cycle canceled or postponed really create significant psychological burden on top of the burden that we already know they're feeling just by trying to navigate infertility treatment and starting their own family.
The other thing we know is that for those of us who work within infertility clinics, is the pandemic is impacting us as well. So, we were all trained and we all want to be caring for patients, but most people, or maybe everybody in these days, even if we're healthcare professionals, most of us are feeling very distressed personally. We want to support our patients, but the idea of this webinar is for us to teach you skills which you can teach your patients to reduce their distress level. These are also strategies that you can use yourself.
So the first tip that we want to kind of teach you to all teach your patients, but also to start working on in your own lives, is to really limit the time you're spending on watching pandemic news right now, because it can really increase distress levels. We want to encourage our patients to pick just a couple sources, credible sources that they can listen to, and maybe just pick a couple times a day that they're checking in, but not staying glued to their televisions or their newspapers all day long. Setting a timer can really help. If you say that I'm going to only spend 20 minutes looking at what the headline news are for the day. So a few updates each day should just be fine. Definitely not before bedtime, because we know that that's when it can really interfere with our sleep patterns.
So tip number 2 is try to establish routine. So what you want to do is make a plan. And this is something I've been telling. I'm doing all my patient visits right now via Zoom. And I basically told every one of my patients is, even though you're working from home or your schedule is different, you need to have structure. Human beings like boundaries. We like structure. So what you want to do is to create and write out your routine. So even if you're working from home some days, you want to wake up. And this is what you need to tell your patients. And I'm guessing that a lot of your patients are maybe working from home at this point. So you want them to wake up at the same time each day, shower at the same time each day, and get dressed. I've had so many patients in the last month where they clearly didn't know at the beginning that with a Zoom session, I can see them. And so I had a few patients in the first few days who we would start Zooming and they'd be in their pajamas. It was obviously they haven't showered. Their hair was everywhere. And so I'd say, look, first of all, I can see you. And secondly, it's going to be better for your mental health if you, get up, shower, get dressed, do your hair. If you want to do your makeup, you want to keep the same work hours if you're working from home. No matter what the situation, you want to eat meals at the same time. And all of us need to figure out a way to exercise. There was something on the news recently. I always seek out good stuff on the news, of a man who literally ran a marathon on his balcony. He went back and forth, back and forth, and back and forth, and back and forth to get exercise. So be creative, do things online, do workout videos, whatever it takes. But you want to keep a schedule and you want to figure out a way to exercise.
And tip number 3 is to stay connected. It's critically important for people to stay connected right now. We know that infertility patients can already become a little bit isolated. They sometimes don't connect with other people because they feel misunderstood. And so now, especially when people may be sheltering in place and creating physical distance between one another, staying connected is really important. People can get really creative here. So if they like to cook, you can encourage patients to cook with their friends online. If they want to join book clubs or do games together or hobbies together online, they can get together virtually for coffee or tea or happy hour to have a glass of wine at night. As Dr. Domar was saying, they can engage in lots of exercise classes online. We're lucky in the sense that so many things can be offered virtually now that people can still stay connected. That being said, it's also really important to be alone if that's desired. Creating space when people are on top of each other a lot in small apartments sometimes can be really important. Having some sacred space, even if it's just a corner that belongs just to them, where they can have a little bit of alone time as well.
So now we get to tip number 4, which is relaxation techniques. So one of the best antidotes to anxiety, and I would say that pretty much all of us are experiencing anxiety right now. People feel unsafe, they feel scared, things feel very uncertain, and in effect you cannot be relaxed and anxious at the same time. And so there are 2 different ways to integrate relaxation into your day-to-day life. The first is what we call mini relaxations, and mini relaxations simply are taking slow, deep breaths. It's almost like a sigh. So even just go, And even just taking a sigh like that, you can almost just feel your body starting to relax. And when you do what we call a mini, you focus on diaphragmatic breathing. So when we get nervous or tense or anxious, we tend to do what we call thoracic breathing, which doesn't allow our lungs to fully expand with air. And when your lungs don't fully expand with air, you get poor oxygen exchange, and your heart has to work harder, so your blood pressure and heart rate go up. And so mini relaxations, which are based on diaphragmatic breathing, basically force you to do diaphragmatic breathing as opposed to thoracic breathing. Your heart rate and blood pressure come down, and that's good for you when you start to feel more relaxed. So there are lots of different ways to do a mini. I'm just going to introduce a couple of them, then you can practice these. I would suggest you do minis as often as you can. You can do minis while driving as long as your eyes are open. I personally do minis every time I'm stuck in traffic. I do minis during meetings. They just are instant stress relievers. So one way to do a mini is to switch over to this, deep diaphragmatic breathing. And what you want to do is count down from 10 down to 1, one number for each breath. So the first breath is 10 and then exhale. The next breath is 9 and then exhale. And then when you get down to 1, you will probably feel more relaxed and less anxious. People will not know you're doing this. It just makes you feel more relaxed. Another way to do a mini is to count from 1 to 4 as you inhale, and then 4 to 1 as you exhale. So as you inhale, you say to yourself, 1, 2, 3, 4. And as you exhale, you say 4, 3, 2, 1. And do 3 or 4 breaths like that. And again, you're just going to feel your anxiety level starting to come down. Another way to do a mini is to take a slow, deep breath in, count to 3, exhale, and count to 3, and do 3 or 4 like that. What I tell my patients is I want them to do a mini every time they tune into the fact that they're anxious. And so we want our patients, and we want you to start sort of checking in with yourself as frequently as you can and say, hey, how am I feeling? Am I feeling anxious? Am I feeling overwhelmed? And if you are, do a few minis. So you want to do a mini anytime you feel anxious. You also want to start noticing situations which make you anxious and do a mini ahead of time. So for example, if going to a grocery store makes you anxious, before you walk into the store, just sit and do minis or stand and do minis for a few minutes to just bring down your stress level. The second way to integrate relaxation into your life is to develop a real relaxation practice, which involves doing longer relaxations for 10, 15 minutes a day. And there are thousands of ways to do that. You can do meditation, you can do yoga, you can do progressive muscle relaxation. There are all kinds of, there's imagery. And the idea is to do it on a regular basis, because after a couple weeks of doing a regular relaxation practice, you will have what's called the carryover effect, which means you just start feeling more relaxed and less anxious throughout the day.
So tip number 5 is really about setting boundaries and learning to say no. And this can take some practice, but with some practice, it can get easier. It's important to maintain solid self-protection zone, a little space around yourself that's protective, especially during a crisis like this when we tend to give a lot of ourselves and then we become overextended and we can get really burdened by being overextended. So you want to advise your patients to think very carefully about committing themselves and about saying yes to too many requests. So this could be things like working extra shifts, volunteering, donating time, energy. Next slide. So there are several ways to say no. We know that no is a full sentence, but it's often really hard sometimes just to say no and stop there and expect people to just respect that that's the boundary you're putting in place. So we like to think of it in 3 different ways that we can say no. One would be to encourage your patients to say no, but how about, and then you can use an alternative. So if they're being asked, for example, to donate money, they can say, no, right now, financially, things are a little tough for me, but how about if I donate food to the pantry, or any other example of how they can maybe donate time or energy. The second way can be no because, and the because is simply an explanation of something that could be a very valid reason for why they can't do what you're asking them to do or what someone is asking them to do. So it could be, no, I'm unable to come back to work right now because I'm taking care of an elderly parent who is, more susceptible right now to the virus. And the third thing, and this is one of my favorites, is I need to get back to you about that. So many times we feel obligated to just sort of spit the answer out and just give a reaction. And the truth is it's perfectly valid to say, I need to think about that request and get back to you with my answer in an hour or tomorrow or next week.
Tip number 6 is actually probably one of the most important, because if we don't take care of our bodies, if we aren't healthy, we're not good for anybody. We're not good for our patients. We're not good for our family. And so it's really important to look carefully at your health habits right now. And it's not just your health habits, it's also the habits of your partner. So for example, if you're trying to keep as healthy as you can, but your partner smokes, that is going to affect your own health. And so you want to take care of your body. You want to feel stronger emotionally and physically. And, I don't think we think about this all the time, but if your body feels out of shape or you haven't eaten well or anything else, it's actually going to affect your psychological well-being. And if you take good care of your body, you feel stronger. You feel stronger emotionally. You feel stronger physically. And once you take care of your body, you'll find it'll make you feel more in control. It's easier to cope if you're feeling really healthy. And so one of the ways to stay healthy is to think about your health habits. And what we teach patients, because right now there's so much out there about comfort foods. And, you need to have, ice cream, and you need to have pastries, and you need to have this because those help you feel better. And you see all these advertisements for just the foods you had when you were a child that made you feel good. And there's nothing wrong with having a glass of wine or a cup of coffee or ice cream, but you really need to focus on doing that in moderation. And so what we teach our patients is what we call the 80-20 plan. And so what you want to aim for, that 80% of what you eat is the good stuff. And the good stuff are the fruits and vegetables and the lean meats and the fish and the nuts and the whole grains. And you all know what the good stuff is. So what you want to do throughout the day is balance. So 80% of what you eat is the good stuff. And the other 20% can provide those comfort moments that you can have the cookie or the ice cream or the pastry or whatever. You can have that, or chips, or if you're a savory person. I'm personally a chocolate person, but if you're a savory person, the 20% can be what you want. It'll provide that comfort, but it keeps out the guilt. You could have the bag of chips saying, aha, this is my 20%, and that's really okay.
So number 7 is sleep habits, or sometimes we refer to it as sleep hygiene. And we know from our patients right now that sleep is a really big, their sleep affected right now. Either they're experiencing insomnia where they can't fall asleep or stay asleep, or some people are feeling so much distress that they're sleeping more than they normally would. And so sleep gets affected very early on when we see levels of distress increase. So good sleep habits can really, really significantly improve sleep and mood. It's very tied to people's affect. So we want to first limit caffeine and eliminate nicotine if possible, and certainly late in the afternoon and the evening, because the later we go during the day, the more it affects us at night. Limiting alcohol is really important. Alcohol can be very tempting as a way to soothe and as a way to fall asleep. But we know that people wind up waking up in the middle of the night. Alcohol is a depressant, and they wind up waking up not feeling very rested. So we want to encourage our patients to stay away from alcohol as a way of sleeping. Establish a regular exercise routine, definitely not before bed because it can be a little bit stimulating, and we want people to fall asleep in a calm, kind of quiet place, not exercising 30 minutes before bed and feeling really revved up. Keep the bedroom cool and as dark as possible, and keep to a regular nighttime routine. We really want to encourage patients, and all of us as well, to set up soothing experiences in the evening, trying some of the relaxation techniques that Dr. Domar just went over, or maybe listening to some music, reading a book, things that are soothing, dimming the lights. And definitely, like we mentioned before, watching TV right before bed or being on a phone or a tablet, social media, we really want to eliminate that. Definitely 30 minutes before bedtime, if not more. And plugging in those devices away from the bed can be very, very helpful, because it's too tempting for people to wake up in the middle of the night and then turn to their tablet or their phone, and then all of a sudden they find themselves up for hours.
So tip 8 is the whole concept of hope and balanced thinking. We may all feel so overwhelmed by what's going on that we aren't able to balance our thinking, and we tend to dwell on the negative. So every day or hour feels like it brings changes that cause us to feel that we've lost control. You may, look at your phone and find out that a friend or a family member is sick. I think what we're talking about here especially is what you can do to start to feel better. Our patients, infertility patients, tend to run on the very anxious and sad side. And so it's hard to help them to maintain hope and balanced thinking. But when we feel powerless or we feel helpless, that can be really debilitating. And this is something that, if you look at animal research for decades and decades and decades, if you take choice and control away from anybody, that individual or that creature is going to start feeling really anxious. They're going to start to feel hopeless, and they're going to just fall into a terrible state of despair. And so what you want to do is, it's a concept called cognitive behavioral therapy, where we want to help people challenge automatic negative thinking patterns. And so we ask our patients, and I would ask the same thing of you, is identify the thought. What is the thought that's going over and over and over in your head, the one that's causing you to feel panicked or afraid or sad or frustrated or helpless, and challenge that thought. And so, for example, the first thing you want to ask yourself is that thought contributing to my stress? And if the answer is yes, you need to figure out a way to challenge that thought, to distract yourself, to restructure that thought, or come up with a realistic, more balanced thought. For example, with our patients, and this is before COVID-19, I'd say 99% of my patients, no matter what's going on in their infertility journey, have this thought, I'm never going to have a baby. And I would challenge them, and they'd say, no, I'm just really afraid I'm never going to have a baby. And I'm like, okay, yes, you are afraid. That's realistic. But if you knew you were never going to have a baby, you wouldn't be going through all this treatment. And so what we're trying to do here is to challenge these thoughts into more rational thoughts. So, for people to say, everyone I love is going to die of COVID-19. Okay, that's not a rational thought. It's tremendously contributing to your stress. And you need to identify it, distract yourself, and come up with I have a lot of fear about this pandemic. And that's a true statement. All of us have a lot of fear about the pandemic. And then you need to ask yourself, what can I do to help myself, to calm myself down, how to restructure this thought? We are in charge. We do have control over these thoughts in our heads, and you just need to sit down and challenge those thoughts.
So tip number 9 is one of my favorite ones. It's self-care and joy. And when we hit times of real challenge or struggle, we tend to pull back from experiences of joy or making sure that we take care of ourselves. And it's actually a time when we need to be most vigilant about that. We need to make sure that we're taking time to bring pleasure and joy back into our lives. So many things are out of control, but the one thing that we can still control is how we spend our time and how we bring joy into that space. And by nurturing ourselves, we really reclaim power, and by being more in control of our body and mind really leads to more happiness. And one of my favorite things is to make a list of 20 things that bring you pleasure or joy. And you can do this with yourself, your partner, your friend, your family member, or yourself. Just number 1 through 20 down on a piece of paper, and then just don't censor yourself. Write whatever it is that brings you pleasure and joy. And if you have a hard time filling up those 20 things, try and think about things that engage the senses. It can be sight, sound, smell, touch. So you can put flowers in every room of your house. You can light a scented candle. You can eat something guilt-free. You can put on music that makes you feel good, or put on your favorite pajamas or sheets that make your body feel good when you get into bed at night. So just think about your senses and what kind of brings in pleasure.
So I just want to add to that to Liz in terms of flowers. So I was waiting in line, long line, to check out of the grocery store the other day, and I left my cart to go get some flowers, and the man behind me said, "Why are you buying flowers? They just die." And I said, "Before they die, they bring me a lot of pleasure." So I think, yeah, is it $5 I could spend elsewhere? Yes, but when those flowers are in the vase and making my house smell nice, it really does bring me a lot of pleasure, and it's a really good way to self-nurture. So that brings us to tip 10, and this is really advice for us, for you, for those of us who care for patients. So all of us have concern. You've got concern about your patients, you've got concern about your own health, and you have concern about everyone in your life, your friends, your family members, your neighbors, your coworkers. Many of us may be really angry. How can this happen? Why is this happening to us? How long is it going to last? We might feel very uncertain about the future. People may have planned graduations and weddings and vacations and school plans, and everything feels up in the air right now. But you need to start practicing patience and compassion, not just with others, but this is a time where we tune in. All of us are healthcare professionals. We've all been trained and we love taking care of other people. This is actually a time where you need to start taking care of yourself.
And just along those lines, we all are used to caring for everyone else, and we are also used to being the target sometimes of a lot of negative patient emotion. We deal with a very high level of distress in our patient population on any regular given day without a pandemic happening in the world. And so we are often the recipients of a lot of distress, whether it's anxiety or fear from our patient population. Now you add on top of that closed clinics, canceled and postponed cycles, and we definitely can become the target of a lot of anger and rage and sadness from our patients. And over time, that can really leave us feeling very fatigued and less compassionate. So just learn to recognize in yourself if you if you start to notice you're less empathic, if you start to become desensitized to the needs of our patients. And that may be a time to really reach out to some colleagues, to some friends, to a therapist, to try and talk it out so that we can maintain our compassion when we need it the most.
And so what happens when we run out of compassion? I mean, I think all of us have come home from work and said to someone, "Oh my God, I'm so burnt out." And, there's burnt out and then there's burnout. And so, I'm going to sort of run through these because I want you to look at this list and think about whether or not you recognize yourself here. Are you feeling, sad, depressed, or apathy, which means you start to not really care? Have you found yourself feeling very anxious or very compulsed, obsessed with doing things? One of the things that I talk to my patients a lot about is, our brains are not subtle. And when we are on overload, our brain sends all these signals to say, hey, you need to slow down. And the way the brain does that is it gives us physical symptoms. And so do you have headaches? Do you have neck pain? Do you have insomnia? Do you have, stomach pain, constipation, diarrhea? Do your joints hurt? Do you feel short of breath? Do you have palpitations? Those are all symptoms that you're just burning out. You're pushing yourself too hard. And your brain is trying to tell you to start taking better care of yourself. Do you find yourself feeling cynical and maybe not as nice as you used to be? Are you getting really frustrated with things that normally you would have found as a challenge and now you feel overwhelmed? Do you start blaming others? Are you feeling irritable? I mean, again, most of us in healthcare are relatively patient because we like taking care of other people. But once we get towards burnout, we find ourselves feeling really irritable. And you start, I know how I feel when I'm burnt out, that I just can't stand all these emails I'm getting from patients. And that irritability is a sign of burnout. Another sign is just sort of lacking the compassion, feeling indifferent to your patients, or just pulling back. I mean, one of the great things about working in our field is we tend to work with amazing people and we feel very connected to them. And are you starting to pull back and not feel connected? Are you paying less attention to your self-care? If you're working from home, are you showering and doing your hair and getting dressed? Are you feeling just exhausted all the time? And do you have feelings like you're a failure and that nothing you can do can help? You're not doing your job well. You might even, feel that you need alcohol or drugs to cope. Any one of these or more than one of these might be signs that you're just feeling burnt out.
Yeah, and to some extent it's normal right now to be feeling a tremendous sense of burnout and compassion fatigue. I know in New York, where I'm working, a lot of our physicians have been redeployed or repurposed to other departments to manage COVID, and I'm sure that's the case around the world. And so they're being pushed to the limits of what they were trained to do. And in terms of feeling the guilt that they need to be doing more, but they feel like they can't do more. So there's a lot of very intense feelings for our healthcare providers right now. So the good thing is there are very simple things that we can do to make some of this burnout and compassion fatigue a little bit better right now. We can take frequent breaks in between phone calls or in-person visits or Zoom calls, telehealth. We can walk around the building or go outside if we're able to, read some online jokes, get a cup of tea or coffee, do some simple stretching at your desk. Some simple yoga maneuvers can really just kind of get you, centered again. And some deep breaths. The minis would be some great examples that Dr. Domar taught you earlier on. And if personnel are being limited and you don't have your normal support team surrounding you at work, make sure that you're connecting. When we talked about that connection being one of the tips, connect to people any way you need to. Reach out to the people you know can give you the support you need on the phone or online right now. It's really critical that people stay connected to help with this burnout and compassion fatigue.
So how do you know when you sort of cross the line when you or your patients, and this is something that you can ask yourself when you're talking to patients, how do you know when you cross the line where you actually might need someone to support you and that you just can't do this yourself? So I'm going to just list these things, and I want you to think to yourself, do you recognize yourself, or has one of your patients mentioned all this to you? So have you lost interest in activities which used to make you happy? I mean, maybe you used to love watching old movies or doing jigsaw puzzles or baking. Have you lost interest? Are you unable to think of anything out of the pandemic? And I have patients right now who says, oh my God, I have the news on all the time. I'm constantly looking on my phone. I can't think of anything but the pandemic. Are you finding yourself isolating yourself more? So maybe you go to work and do your job, but when you get home, you don't want to talk to anybody. You don't want to see anybody. Are you having more difficulty with other people in your life? And that sort of goes back to the irritability I was talking about. Are you just feeling intolerant of other people? Or are you feeling just sort of numb, that like nothing seems to faze you? Or are you sort of racked with anxiety and fear? Do you feel bitter or guilty? Do you feel worthless, hopeless? And do you feel you're being punished? And, a big hallmark of burnout and feeling like you need to reach out is that you can't sleep. You're either not eating or eating too much, or you're drinking too much alcohol. And if you have a lot of those symptoms that I mentioned before, that, when your brain is really trying to tell you, you need to change, you need to do something different. Are you having a lot of headaches? Are you feeling like you have a lot of stomach problems? And are you having rashes? Because any of these are symptoms that maybe you need to talk to someone who can just teach you some coping skills so that you can use them yourself. That will be within your control to help you feel better.
Yeah, control is such a big thing. I mean, I usually have patients make a list of the things that they can control and the things they can't control, because what we often try and do is ruminate and obsess over the things we cannot control, which only brings about more frustration, more anxiety, more depression, and more distress. So things like the behaviors of others, or low supplies of food and paper products, or for our patients and for ourselves, when are clinics going to open again? When can patients get back to treatment? All of these things are completely out of our control to some extent. So instead of wasting all of our energy and resources focusing on those things, we really want to encourage ourselves and our patients to focus back on the things they can control. And the things they can control are all the things we're reviewing with you tonight. So decreasing the amount of time you spend on social media, connecting with other people, and making sure that the people you connect with are supportive people in your lives. looking at the food you're eating with that 80-20 plan, sleep hygiene, all the relaxation techniques, noticing if you're burned out or having compassion fatigue. So all the tips we reviewed tonight are within our control, bringing pleasure and joy back to our lives. And that's a lot of things that we can do to feel more empowered and to have hope back in a situation where the rest of the world feels very out of control right now.
So what do you do if you really feel like you're just not coping, you just don't know how to get out of your pit? The example I always use with my patients is if you feel like you're just stuck at the bottom of a pit and there are no ladders out, and if you're feeling like you're in that pit and there are no ladders out, and you're feeling that it really impacts your day-to-day life and it goes on for days or weeks, that's the time to take a step and use what I call the ladder. You know, it can be a clergy person, it can be a counselor, it can be a doctor. You know, if there's a mental health professional in your clinic, you know, I spend a lot of my time right now, you know, I'm at Boston IVF, I spend a lot of my time talking to other employees who are just feeling overwhelmed. But, you know, you need that ladder. You need something to get you out of that pit.
So we're going to conclude right back where we started with slide number 1. We're going to emphasize the fact that it is completely normal right now to feel anxious and overwhelmed, because when you are in an abnormal situation like this pandemic, the normal response to an abnormal situation is to feel distress. So it's very comforting and validating when we can tell ourselves that and our And in fertility patients, as we reviewed with you, the literature is very clear that our patients on any normal given day, when they're just trying to cycle through an IVF cycle, are feeling a tremendous amount of anxiety and depression. So you add the pandemic to this, and it's really amplifying their feelings of being overwhelmed. So they are in tremendous distress right now. And practicing these tips can really help people feel more in control over the things they can control while they're waiting to get back to treatment and while they're waiting to get back to their quote-unquote normal lives. So the idea of see one, do one, teach one. You know, we really hope that everyone walks away tonight with the message that first we have to have compassion for ourselves, and we have to practice self-care by doing all these tips for ourselves. And then we can teach them to our patients and help them as well. And we can recognize the signs of when we all need to really get the support we need to feel better.
So this is the conclusion of our slide deck, and I think Dr. Budi is going to coordinate a question and answer session.
Yeah. Okay, thank you. So regarding the pandemic situation that will amplify the stress of our patients, so the first question is it possible for us to start stimulation right now in order to this one is coping strategies? Is it possible or not? What is your opinion?
I mean, you're asking us as psychologists, is it possible for patients to start stimulating medications right now? I would turn that right back to you, Dr. Budi. You're a physician.
Okay. Yeah, later we can discuss later, I think. And then the second question is also some patients with advanced maternal age, which is this very urgent situation, and then might be the couple have very high grade of depression. So in this situation of the patient, can we apply all your 9 tips or all the 9 tips or all the 10 tips for coping the stress?
Dr. Girl, do you
Go
ahead?
Yeah, I mean, definitely these tips are really, they transcend the pandemic and they transcend infertility. The beauty with these tips is that they really are for any time someone is feeling distress or feeling overwhelmed in life. So even in situations of advanced maternal age where people are feeling this desperation to get back to treatment, which is completely understandable, feeling more in control of their lives right now means being in the best mental, emotional, and physical condition they can possibly be in by using these tips, so that when they can get back to treatment, they feel empowered that they did everything they could during this forced interruption or this forced break.
I think there's I want to say, I don't want to misquote this, but I think there's a Chinese symbol that crisis equals opportunity. And, one of the strategies I've used with my patients for the last 4 or 5 weeks, these are patients who have, low AMH or, obviously diminished ovarian reserve, or they're over 38 or 40 years old, and they're frantic. And I said, okay, I understand this is a crisis, but maybe we could look at the month or 2 or 3 before you can cycle. Let's look at this as an opportunity. So what can you do in this 1 or 2 or 3 months to make yourself as physically and psychologically healthy as you can? And, if you go over the tips, does this mean you should decrease alcohol consumption? Does this mean you should, try to increase your exercise routine? Does it mean you need to learn sleep hygiene so you're actually getting an adequate amount of sleep? Can you use this time to either bring down your BMI if you're obese or bring up your BMI if you're underweight? And I have to say that pretty much every one of my patients, when I've talked about this with them, sort of start to see the pandemic in a slightly different way. And they do see this as an opportunity in how they can get as healthy as they can physically and psychologically before they start cycling again.
Okay, absolutely. It's very interesting. So there's one question also regarding the jogging in the park. So some patients prefer to have a jogging in the park. So what is your comment?
Yeah, I was reading that comment. I think, again, that's more related to the medical aspects. I think it was a question more related to can they be exposed to COVID, and that's sort of outside of the domain of what we can speak to in terms of the actual medical aspects of the virus. Yeah.
Okay. There's also one question from Dr. Singham. Will this psychological stress cause an issue like dyspareunia or vaginal dryness?
Yeah, we could do a whole lecture on sexual dysfunction and how it relates to infertility, but I don't want to get off topic. One of my little subspecialties, but I'll just say that fertility patients who are not dealing with the extra stress of COVID-19 already have a lot of sexual dysfunction. So dyspareunia and dryness and all other aspects of sexual dysfunction, erectile dysfunction. So these are all issues with couples as they navigate the journey of trying to conceive with, IVF and other treatments. And anytime you add extra stress, it can absolutely affect sexual function as well. So this will also make that more possible.
Yeah. Okay, and then the next question from Dr. Dr. Hemafati. The patient accidentally conceived even in spite withholding infertility treatment. So what best advice can we give to the couple if they fear that some complication would occur to the fetus?
Well, I would turf that right back to you, Dr. Budi. What advice are you giving as a physician to your patients who do conceive right now?
Yes. Actually, we did not recommend our patient to have pregnancy right now. Yeah, the first, of course, if the patient seeking the fertility service, they have the risk for having transmission of COVID-19. And also, if they got pregnant, of course, in the pandemic area, even until now, the evidence still not clear. So there is no evidence, that COVID-19 will have vertical transmission to the fetus. But maybe in the psychological aspect, some couples who have pregnancy in the pandemic area, they have a fear, the psychological stress, because they're really of COVID-19 during their pregnancy. So I think this is the recommendation from the clinician.
I would also add to that, because, it's not that uncommon for patients to spontaneously conceive in between treatment cycles. And I think what you'd want to reassure that patient is, again, this is a really good time for her to work on her emotional and physical health. I mean, obviously, because of COVID-19, she wants to be extra careful about leaving her home and washing her hands and everything else. But you don't want her, hiding in her bedroom with the covers over her head and trembling with anxiety. You want her to live as normal a life as possible. But this is a really good time for her to learn relaxation techniques and eat good food and watch her health habits. I mean, she has the time and the opportunity to do that.
Yeah.
And I do think that our patients that are pregnant, either had finished an IVF cycle right before we shut down or spontaneously got pregnant on their own, they are feeling a tremendous amount of distress. So I think it is impacting them psychologically. And then obviously going back to all these tips can help them manage the anxiety.
Yeah. I think all of us have found that for patients, pregnancy after infertility can be more anxiety provoking than infertility.
Okay. And the next question regarding the telehealth system. So as you know that many professional organizations and government right now recommend the patient to having telehealth services, reducing their visit to the outpatient clinic. So do you think by telehealth services, virtual communication between doctors and patient can this become a good coping strategy?
Yeah, I mean, connection, right? Like we keep stressing connection. There's definitely differences and barriers to it. There's no question when you're sitting in front of a patient, the energy you feel with them, the emotion that you feel with them, the nonverbal communication is much stronger. But in times of crisis, if it's a decision whether to have limited conversations or even just the phone, I think seeing people's faces is the next best thing to being in person sitting with them. Just be aware of the limitations and the differences. But I think for the patients, it's really critical that they feel connected to their physicians or their therapists right now.
I mean, I have to say, I had never done, Zoom sessions until about 5 weeks ago. And I was a little concerned. But what I found is, and it is, I was especially worried about new patients. I mean, if I've been seeing a patient for weeks or months, it shouldn't make that much a difference. But I'm also seeing new patients. And, I've noticed two things. One is, I'm much more comfortable doing it than I thought I would be. And I think my patients have also expressed surprise about how easy it's been for them. But I've also noticed my patient volume has doubled because, for patients to have to take time off from work or whatever and drive to Boston IVF, they now realize that they can do this from their home or from their office. And so, in fact, they are getting a lot more therapy and they're getting better faster.
Okay. There's another interesting question also regarding the managing the media. Yeah, in number one of your tip is managing the media. So there's a question. We know that every day the media updating the pandemic COVID-19 situation, the number of people dying, and a lot of anything. So do you think that by managing media, we should ignore this information?
I think what you need to do is to limit it. What I advise patients to do is maybe they can check in, in the morning and just sort of look at the headlines for 5 or 10 minutes and maybe do the same thing at the end of the workday. I mean, I think we do have to be aware also that the media is going to cover the most dramatic stories, which tends to be the hardest stories because that's what, people buy newspapers because they want to hear about the drama. And so what I've been advising my patients to do is, okay, check the headlines, scroll through things that are hard for you to see, but the media is also covering the good stuff. I mean, they're showing the really amazing stories of, neighbors who've never met bringing groceries and, people volunteering. And, there have been all these stories of disabled children who are having birthdays and they can't have a birthday party. And, 100 people walk past their house honking and, throwing flowers. Those are the stories I think all of us need to be looking at, checking on the headlines to know what's going on, but then keep on scrolling down and get to the good stuff because there's a lot of stuff that makes you feel really good about your fellow man.
Okay. So there is, yes, also the interesting question, how is your tip? We are facing the anger patients, how to handling the anger patients. If the patient gets
Yeah,
angry.
angry patients are the hardest ones to manage. Dr. Domar and I usually give a talk on how to manage difficult patients, and that's the question we get sort of the most about, is how to deal with the angry ones. I think the first thing you need to do is just validate their anger. The tendency when someone is coming at us and they're angry, the tendency is to sometimes be defensive and to push back, and that's only going to make the anger worse. So the best thing that you can probably do is just to say, I understand that you're very angry, and I can understand you're angry about X, Y, or Z, you know, be able to put back in their own words what it is they're upset about. I think that's the first step anytime you have someone coming at you with a lot of anger, is to just validate their experience.
I mean, the key here, as Dr. Grill says, is empathy. And, you know,
Yes.
to say, you know, I understand this is frustrating. I understand this is not what you anticipated. I understand you're really scared. But I think we also have to not take it personally. And, you know, what I'm always telling my patients, and I'm often telling my coworkers, when a patient is angry, just take a step back and think about where that patient is coming from. And you will recognize the anger has nothing to do with you. But that patient feels safe, unfortunately, getting angry at you, because they may not be able to get angry at their physician or their partner or whatever. And just try to understand why the patient is frustrated. I've had so many patients who are angry, and I literally just listen to them. I don't say a word, I just listen. And they sort of start to wind down, because once they get the anger out, they feel better.
And I'll also add that it's also important to add boundaries. There are the occasional times where it can go over the line and it can feel more abusive, and that rage is a little bit too much. And then it's perfectly fine to redirect the person and to tell them, I really want to hear what's upsetting you, and I really want to be able to help you make this better, but I'm going to need to ask you to lower your voice, because I really can't continue to talk to you if you continue to scream. You know, those types of things can redirect them.
Okay, thank you. I think one last question is also, there's a question regarding any benefit to give some medication like tranquilizer for our patient in reducing the stress.
You know, I wrote a literature review that was published 5 or 6 years ago in Human Reproduction on the risks and benefits of antidepressants with our patient population. And it really focused mostly on SSRIs, which is a form of antidepressant. You know, I think it would have to be a pretty extreme situation to give a patient anti-anxiety medication. And I think before I would feel comfortable having one of our patients take an anti-anxiety medication, I'd want them to be evaluated very carefully by a mental health professional to just figure out what's going on. And I would say the same thing about antidepressants. It's not a terrible thing for our patients to be on antidepressants, but it's never my first choice to take a healthy, normal young woman or man who are just feeling distressed about their life. And I always try to start by teaching them a lot of these cognitive behavioral and relaxation tips first. And if they don't work, then you can discuss medication.
Okay, thank you very much. I think before we close this session, we need invite both of you to have one statement, a closing statement, the message for our participants in reducing the strategies for reducing the stress for our patients. Dr. Drill, please, your message.
Yeah, I would say that, again, think about the things that you can control versus the things that you can't control right now. And even if you have to make a list, just look at all those things that you can't control and put them aside, and then focus in on all the tips that we went over tonight, and try practicing them for a couple of days or a week. And I think you'll really start to notice that you feel more empowered and a lot more in control than you think.
Okay. Dr. Domar?
You know, I would agree with everything Dr. Grill just said. I think another thing that we've talked about is you need to have some compassion for yourself, because this is unprecedented. I mean, I keep on talking to my therapist friends, and, you know, we weren't trained to counsel patients during a pandemic. I mean, none of us were prepared to do this. And I think that if you're feeling anxious and overwhelmed, as we started off the seminar, we said this is a really, really normal way to feel. And so I think we have to have compassion for ourselves and, you know, not be frustrated with yourself that you're not feeling calm and composed all the time. You're entitled to have your moments.
Okay, I think we are coming at the end of this session. On behalf of the ASPIRE, I'd like to thanks to all of you, to the Dr. Domar, Dr. Brill, for very great contributions to our webinar today, and also to Ferring Pharmaceuticals. Thank you very much for your support to our ASPIRE first webinar conference. And the last, finally, I think there are 9 tips for our patient and 1 tip for us as healthcare providers. And then just continuing, think positive, relax, and then giving the confidence to our patients that they getting pregnant soon after this pandemic COVID-19 is over. So thank you very much and stay healthy for everyone. Thank you, Dr. Domar.
Thank you. Thank you.
Thank you. And I close the session. Thank you very much for your kind attention.
Thank you.